Okay, so welcome to Let's Talk for December. It's part of the World AIDS Day week that we're doing here. And thanks to MacAIDS Fund, Vive, and for MSD for hosting us, as per usual. It's great to be here. And tonight I'll talk, I'm from Body Positive. I'm the executive director at Mark Fisher. This is one of our initiatives. This is probably about our fifth one. So the idea is we're spreading education to people in lay terms they can understand. That's a key point of these talks, is to keep it simple so everybody gets an education about what's going on. In this particular talk, what we've done is we've hooked up with the Australian Federation of AIDS Organisations, AFAO, and they've produced this new magazine here called Gay, Sex and Risk. Theirs has got a different title. But basically what it's talking about is the risk if you're having sex with another man as a male person, and what you can do to minimize that risk. And it's all in plain language, so there's lots of statistics that people put out there, but this is the lay version of it. So it's a really good book. It's available on the Body Positive website if you want to pick it up. So you can download it, or we can send it out, and it'll be in lots of different locations around the country as well. So this book is talking about HIV prevention. So HIV, human immunodeficiency virus, because I'm not allowed to have acronyms, which HIV is one, it's a virus. So it's easy to pick up. It doesn't discriminate. Anybody can get it. So it's not spread by mosquitoes or kissing or toilet seats or sharing food or those kinds of things. It's only spread through bodily fluids such as blood, semen, cum, and vaginal fluids. So there's only certain ways to get it. So pregnancy and breastfeeding is one, but that's basically been eliminated here. We haven't had a pregnant baby for about 12 years, so it's really effective, and that's because of testing. Unprotected vaginal or anal sex, and sometimes oral sex, that's really rare, and sharing of injecting equipment, such as needles. So again, the main way that people get HIV in New Zealand is gay men or men who have sex with men through unprotected anal intercourse. So fucking without a condom. In terms of what's happened in New Zealand recently, the last 3 years, we've seen increasing numbers in men who have sex with men, gay men. So to the point last year, we had the highest number of people ever getting infected in that population since the start of HIV in New Zealand. So that's the highest number ever. So it's going up, which is not a good trend. And a lot of these were new infections, so they weren't. We've been doing a lot more testing, but these were people that were getting newly infected. So people are taking more risks. So that's why we've brought this out, so people are aware and they can manage their risk better. So last year we went up to 136 from 117, and that's the highest number we've ever had. So in terms of risk, the main risk is fucking, so basically. So if you're fucking without a condom, that's when you're most at risk of getting HIV because of the passing of bodily fluids. And so if you're the bottom, you're the receptor, you're receiving the cum in this case, so you're more at risk because you're getting a greater exposure to the potential of HIV if the person who's the top has HIV. So one of the strategies some people use is if they're the negative person, they'll be the top, and the positive person will be the bottom, and it reduces the risk, but it doesn't eliminate it. There's still risk involved in that. And the issue is that the more times you engage in that risky activity, the higher your rate of risk becomes. So it's like if you're playing the lottery. If you play it once, your chance of winning is this, but if you keep playing it every single week, your chance is going to go up that at some point, you might win. Or in this case, if you're playing unsafe sex all the time, there's a point where you'll test positive. So that's why you need to understand what you can do about that. In terms of pulling out, some people think that the idea of as long as they don't come inside the other person, that they're not at risk, they're not going to transfer any kind of infection. That's not true because pre-cum contains HIV as well. So even the concept of dipping is a dangerous one. It's not as high as if you come inside somebody, but there's still a risk involved in that. In terms of viral load, there's been a lot of talk about that recently, especially this year. There's been a lot of research put out in terms of viral load. So what's happened is that if someone's taking medication, they're adherent, their meds are working really well, and they're positive, it'll get to the point where their virus can't be detected by normal lab tests, and so that's what's called undetectable. So they've still got HIV, but we can't pick it up in their blood because it's gone to the point where their meds have dropped it down so that we can't detect it anymore. And there's been studies that show that at that point, your chance of transmitting the virus, because your levels are so low, has been reduced basically to the equivalent of wearing a condom. It's that, in terms of your protection rate, it's actually really effective. So that in that case, if you're in a relationship where there's a HIV positive guy and a negative guy, usually in couples, they haven't looked in casual kind of situations, but your chance of transferring it to the other person is basically nil, or equivalent to condoms, we'll say. The numbers are all different depending on which study you look at. It's not 100%, but it's really, really good. In terms of mixed messages, what we're looking at there is that a lot of people, when they're negotiating casual sex with somebody they've met online, on Grindr or Scruff or wherever, they'll assume because the other person hasn't said anything and they're wanting to not use a condom, that person must be the same status as them. So if I'm negative and they don't want to use a condom, I'm assuming that they're negative as well. And that person may be saying, well, he doesn't want to use a condom, so he must be positive like me. So unless you actually ask the person, that's what you need to do, is just ask, what's your status? So then they can tell you, and then you can negotiate something that's safe for both of you. You can't tell just by looking at someone whether they've got HIV or not. So the same, and so it's just ask. Be safe to yourself, respect yourself, and just take care of yourself. So once you're in a relationship, this is where they're not doing casual anymore. They're with somebody and they're thinking, well, actually at this point, what I want to do is strengthen our relationship by not using condoms to show trust and love and intimacy, all that kind of stuff. So that's where people actually negotiate out of using condoms. And that's where, if you're both negative, what you should do is you should go and get tested, because you're only negative since your last test. So if you've done if your test was a year ago and you've had lots of things going on since then, that's not really valid anymore. You need to go and check to make sure that you're still both negative. And then one of the things that we're kind of encouraging people to do is to come in as a couple. If you're both coming in to get tested together, if one of you happens to be turning up to be positive, then it's a good way to actually support each other and move forward in the relationship and make it stronger. If you get tested separately, it makes it really hard because you have to go and disclose your status immediately to your partner, and that's a really hard step to take. If they tested negative and you've tested positive, that's a really hard discussion to have. So if you come in together, that's a good way to do it. So once you've tested and you know you haven't had any risky activity, then you can actually negotiate to not use condoms. But the important thing is to keep honest and open. So if you play outside the relationship, put some ground rules in. So together, we don't use condoms. If we play outside, we use condoms 100% of the time. And that's why you'll keep each other safe. It's a respect thing. If you're both positive, so you've already got HIV, so you're not going to get HIV again. But you have a potential of getting an STI. So you're going to get syphilis or gonorrhea or chlamydia or hepatitis C, which is another nasty one that you can get as well. So that's really easy to pick up. So the important thing is, if you're both positive, what you should do is get regular sexual health screening as part of your regular doctor appointment. Because you're going to see your infectious disease doctor on a regular basis, just get them to add those tests in, because then they can be treated. And some STIs are a lot worse if you're HIV positive, so it's good to get them treated just so that you're looking after your health. If you're different statuses, so one person's positive, one person's negative, what you need to do is minimize your risk. So as I mentioned before, if the HIV positive person is the bottom, then your risk to the top is minimized. There's still a risk. You still could get HIV from it, especially if you're uncut, because the rectal fluids can get inside the lining of the foreskin, and there's a much greater chance of getting infected. And if there's some damage to the skin or anything like that in terms of openings, or if you had rough sex or stuff, then you could get, you're more at risk. But that's where the undetectable viral load piece comes into play. So if the positive person is adherent to their medications, then their chance of transferring it to the negative person is actually minimal. So that's basically eliminated, as I mentioned before. One of the new things that we're looking at is PrEP, pre-exposure prophylaxis, which is basically where the negative person takes an HIV medication, Truvada. That's the only one that's approved for this so far, but it's not actually approved in New Zealand. And what that does is you take that every day, and you have to take it for, I think it's 10 days before you have your sexual encounter, in order to get your immune system up to full capacity inside your rectum. And then if you get exposed to HIV, the Truvada will actually eliminate the virus from your system so that you don't get HIV. So that's the way it works, but you have to be really adherent to the Truvada. And what usually happens is that first 2 to 3 weeks, you'll feel nausea, you'll get some side effects from it. After the first 2 to 3 weeks, you'll feel fine, but you just need to keep taking that pill. So the important thing is, if you go into PrEP, you need to not have been exposed to HIV, so you have to have an HIV test before it, because if you start PrEP, you could, because it's only one drug, usually you take about 3 drugs. It's actually 2, but it's 1 pill. If you have HIV before you start PrEP, you could become resistant to that drug, to Truvada, which will limit your choices going forward. So that's, if you discuss that with your doctor, they'll actually sort that out and make sure that you're taking it appropriately. And again, if you're one's negative and one's positive, the important thing is to always get tested. Get checked out for STIs. If the HIV person has, or the negative person has syphilis or gonorrhea or such, you're more at risk of getting HIV. It just increases the risk, so it's just good to check in with your doctor every 3 months, get a checkup, get treated. In terms of oral sex, or one of the tips there, people say it's a negligible risk. In New Zealand, there was a court case in 2005 which basically threw that case out because the man didn't ejaculate in this case, the woman's mouth. So here it's not deemed a criminal thing, so there is basically no risk to it. So, but where the risk comes in with oral sex, if you've had a dental procedure, if you've got bleeding gums, you've just flossed, and then you go down on somebody and they come in your mouth, then there's an opportunity for the virus to get into your system. So the idea is, if you're going to go down on somebody, use a mouthwash. Don't go and floss. If you've had a dental procedure, do something else. So that's the way to avoid that. And then once you do that kind of thing, it's actually safe. With condoms, they're the mainstay of prevention. We know they work, we can see them. It's not a case of discussing with somebody about their status. We know the condom protects you, and you know they put it on, you know they work. So it's important to get the right size. There are different sizes out there. It's important to know how to put it on appropriately. So there's lots of videos online on how to do that, like educational videos, not porn. So it's a good idea just to have a look at those, just to learn how to do it correctly. It's important to know how to take it off as well. So once you've actually ejaculated inside the condom, to hold the base so that the fluid doesn't come out inside the person when you take it off. And to look after your condoms, look at the expiry dates. They actually have them written on them. So have a look at those. Don't store them in your wallet, because basically the wallet wears down on it. It could cause them to actually degrade, and just get new ones. There's a really good campaign here through the NZAF where you get free condoms. They'll actually mail them out to you. So, and your doctors can get your condoms as well. So yeah, so there's a really good program, and they work. If you can't keep it up, if you're using a condom, some people have that issue. What you can do is you can talk to your doctor, because there's certain medications that are going to be available across the counter soon at your pharmacy. So you don't even need a script to get Viagra. So you can access that, or you could bottom, and the person who does use a condom does the top. So there's different ways of negotiating safety. In terms of sex play and HIV, Rimming, as the picture shows, that's totally safe. So it's a safe activity. You can do as much as you like. The only thing with rimming is you might get hepatitis A, and you might get some other things like Shigella or Giardia, stuff like that. So you might get some other things happening, but in terms of HIV, there's no risk. Fingering someone, it's fine. Do as much as you like. Fisting is another fine activity. So the only thing with that is that if it's rough, you may damage the person's anus, which makes them more susceptible. If they get cuts and abrasions in there, then later on they're going to be more at risk if they get exposed to some bodily fluids. In terms of toys, they're fine. Don't share toys. If you're taking a toy that you use, don't then go and use it on somebody else, because that transfers all the bodily fluids with it. You can put a condom over it, so that way you can share it. Just put a new condom on it when somebody else uses it, or better yet, bring your own toys, and that way you can choose your favorites and you're good to go. So in terms of douching, a lot of people douche. It's a way to keep clean if you're going into a scene with fisting and stuff like that. Some people just take the end of the hand shower off and then use the hose. They can be fairly rough and they can cause abrasions and things like that. So just be careful with that. You can get an adaptation for that. Somebody like Peaches and Cream would have that for you. So basically you can screw that on to where you've taken the handle off, and then it actually makes it a smooth surface so you won't damage your insides. So that's one of the things you should think about in terms of how you're actually going to prepare for that sexual encounter. Piercing, always use clean and sterile. That's the same as with tattoos and things like that. So it's always clean equipment. In the case of tattoos, if you go to a reputable licensed place, they'll actually show you them taking the needles out of the clean bags. So it's all sterilized, it's new. They're not reusing the same container of ink. It's poured into a separate container, which is just yours, and then it's all disposed of. So it's all clean, so there's no risk. And party and play, that's a big discussion which will come around soon. So that's basically where people are using drugs and sex at the same time, usually meth, G, and then having a party. There's a lot of that happening here in Auckland. So that's where people have lowered their inhibitions, so they'll do things that they wouldn't normally do. It's not that you feel freer. What it's doing is it's reducing your sense of risk. So you're doing things you wouldn't normally do because you can't assess the risk of that activity. So that's where people will decide not to use condoms, or it equates to when you're drunk as well. You'll take unnecessary risks, and so the way to avoid that is to actually prepare. If you're going into that environment, be aware of what you're going into. Make sure you have condoms at hand. What some people do is they'll use a female condom, which is basically where you can insert that in your anus before, and then you don't have to worry about the other person putting it on. So you're protecting yourself. So a few people engage in that. There's lots of resources on that, and we'll be doing a separate talk on chemsex and party and play later. So I'll go into more detail another time. Post-exposure prophylaxis. So this is if you have an accident. So if you're out somewhere and you're with somebody and they're using a condom, and in New Zealand people don't have to disclose their status of being HIV positive if they use a condom, because that's safe. But if that condom breaks, you may now be at risk. So it's the obligation of the person, the HIV positive person, to tell you, to disclose at that point, saying, okay, the condom's broken, you may have been exposed, and there's a risk. So what you can do at that point, if it's within 72 hours, you can go to emergency and tell them the situation, and they can provide you with post-exposure prophylaxis, which is basically HIV medication. You go on it straight away within 72 hours. You go on it for a month, and at the end of that month, they'll do an HIV test, and the majority of the time, you will not have become HIV positive. So you may not have been exposed, because it's not like the first time I come in touch with HIV, I'm going to get infected. It doesn't work that way. But if you did, then this will make it so that you don't get infected, and it'll kind of guarantee that you're safe. So it's an expensive drug. These drugs cost around $1,200 a month. So they'll ask you some questions about what happened, what the situation was. in order to assess whether there actually is a real risk before they'll give you access to the medication. And that's just precaution on their way in terms of saving. It comes down to money. In terms of STIs, sexually transmitted infections, so in terms of a negative person, having an STI increases your risk, because what it does is it inflames an area, and that's an area that the HIV can actually attack to enter the system. For HIV positive men, it's even more dangerous as such to have an STI that's not treated, because it increases the level of HIV in your system, in your cum, your pre-cum, and your rectal fluids, and that makes it more likely that you could pass on HIV to somebody. So even if you're undetectable, it's really important that you get a sexual health check every time you go in to see your doctor, so that they can take care of any of those STIs that are going on. Most of them are really easily treated. Unfortunately, there's some that are coming out now which are drug resistant. So there's more of those appearing on the scene. So it's where somebody's been prescribed an antibacterial that you're supposed to take for 12 days, and you take it for 8, and then you think, oh, it's okay, I feel fine now, so you stop, and then the actual STI hasn't gone away, and it comes back stronger and resistant to that antibacterial, or antibiotic. So it's important that you actually take the drugs as prescribed so that that doesn't happen. In terms of testing for HIV, it's important. I think the recommendation for most people is at least once a year to get just a regular test, just to make sure, just to check up. For people that are sexually active and engaging more in risk, you should do it more often. So 6 months or 3 months, in order just to make sure that you haven't picked up HIV. The new information around treating HIV is if we can treat it earlier, you actually have better health outcomes in the long term. So once you get tested, if you've been infected, initially your virus will go up. You're a lot more infectious to your friends, to your other sexual partners. So it's important to know early on so that you can change your behavior and get onto treatment and into care. But it'll also help you in the long run because you'll live a better life in terms of health. It's an easy test. You can either get it through your GP can do it if you're comfortable with that. A lot of people aren't. So they'll go to sexual health and they'll get tested there for other sexual stuff as well as HIV. Or they come to somewhere like Body Positive or to the New Zealand AIDS Foundation where we do rapid testing. They're the only 2 locations at the moment where you can get a rapid test. So most of those tests take around 20 minutes to do. And what will happen is that at the time of infection, if you're infected today, we can't actually detect the HIV for around 10 weeks from today. So we have to wait. So if you came in, if you went to a party on Saturday, you came to see us on that Thursday, there's nothing we can do. You're too late to go onto a PEP, and we can't actually pick up the virus until 10 weeks from that time. So you have to wait. So in our case, we have a test that does 28 days, but we tend to go longer because it depends on who it is and how fast they react to the HIV virus in their system and how long the antibodies take to come up. So as I mentioned, one of the new things that's coming on is pre-exposure prophylaxis, which is where you're taking an HIV medication, Truvada, daily in order to prevent yourself from getting HIV. So at the moment, this is available in the US, and it's available in a limited amount in Australia through clinical trials. And we're looking at introducing a clinical trial here in New Zealand next year in 2016, probably in the middle of the year it will happen. The problem is that the drugs are really expensive. They're $1,200 a month per person. And there's all these other costs around it as well in terms of care and stuff like that. So, but that particular drug, there's been lots of studies which have shown that taking Truvada daily or at least 4 times a week, as one of the studies said, will keep enough medication in your system that you'll be protected from HIV. But it doesn't protect you from any of the other STIs. So if you're taking PrEP, you can still get syphilis, you can still get gonorrhea, you can still get chlamydia. So if you use a condom as well, then you're doubly protected, so you'll be guaranteed that you won't get HIV and you won't get the other STIs as well. So in terms of who to go to for support, here's a slide. That's us, Body Positive, at the top. So we do HIV testing at our center as well as at sex on-site venues like Centurion. New Zealand AIDS Foundation does a lot of testing around the country and at universities and places like that. They also do testing at the Big Gay Out, so you can get tested there. And the Sexual Health Service as well. So we've got the Auckland one down there, but there are other sexual health services, or you can go to your GP and they'll do it. Just ask as part of your annual checkup, can you add an HIV test to that? So it's a simple thing, and that way you'll know and you'll be looked after. So some of the decisions that people make, this isn't in the book, this I kind of added because I thought it was important to add, is that some people make decisions about their safety and what risks they'll take based on what's happening in their lives. So some people say that, I can't use a condom because I can't get it up. So doesn't mean you should abandon condoms. You can be the bottom. You can use other methods such as using Viagra or something like that. There's other ways to get around that. Or you can use condoms based on the scenario that you're in. So there are ways to get around that. Some people choose not to use condoms because they think the other person is the same status as them, usually negative. So they'll be in a situation, they'll say, okay, I think that person's negative, I'm negative, he hasn't talked about a condom, so I won't mention it, and we'll just go ahead. But you need to ask. Some people go into stress and depression if they've had a recent breakup or something's going on in their life. They kind of don't feel, there's not a lot of self-worth. So they'll go out, they'll take some risks, they'll be, just enjoying being themselves and not caring about what people are telling them to do. And that's when they, and a lot of those people don't care if they get HIV at that point. So they're doing something that they wouldn't normally do because of the emotional state that they're in. So it's just, you should be aware of that and just think about what you're doing and what the long-term effects are. And then relationships and pressure by partners to stop using condoms is the other big one. As I said, as you get closer together, even before you've actually said you're in a relationship, there'll be that question, can we stop using condoms? Because it means that you're more serious and it's part of the relationship building status. But the important thing is a couples testing and being honest about each other and coming up with some rules about how you're going to go forward. And then some other times it's just a momentary lapse in judgment. I was out at a party, there was a really hot guy and he didn't want to use a condom, so I kind of said, okay. And it's just a heat of the moment. So nobody's judging you for that. It's just, you need to be aware and make a conscious decision of what you're doing with your health. Because ultimately it's you. You've got to take care of yourself. And then use of alcohol. So some people go out, they get drunk, or they're using recreational drugs, and that's when they lose that control, they lose that self-control. So they're, you've had a bit too much to drink, you go home with somebody, you're not really thinking straight, and that's when you might turn around and actually just forget to use condoms. You wake up the next morning, it's like, well, actually what happened last night, I can't remember, and that's when you might want to think about accessing PEP. If you think you've actually gone into a situation that may have put you at risk, you could go and see the hospital at that point and say, oh, look, I need to access some medication here. And then there's a small number of people that will actually take advantage of the situation. If you offer to not use condoms, they'll agree, even though it's not necessarily the best thing. So that might happen in a back room somewhere or something. So again, take care of yourself. So this presentation we're doing is part of World AIDS Day week. So tomorrow is Friday. There's a big street collection we do just about raising awareness. The main part of this week is to essentially eliminate the stigma that goes around HIV, the fear of getting tested because you might come up positive. HIV is a manageable condition now. If you get tested, if you get linked into care and you go onto medication, you can live a normal life. So there might be some side effects until we get the drug combination right, but there shouldn't be a fear of getting tested because you'll actually live better and longer. If you leave your body to fight HIV by itself, that's like going back into the 80s because you don't have the support of the medication and your immune system will be weakened. So you need to get tested, and just to support people that do come to you as positive. You know, if people get diagnosed, it's important to reach out and support them, not to turn away, which some people do. It still happens today where people turn away from their friends because they're diagnosed positive. And then we have the other thing in terms of raising awareness, we're doing a number of different festivals this week to basically re-engage people in HIV, which is what these talks are about, is to get people educated, to get them involved, to remove the stigma and fear, and just to make HIV a normal part of discussion so people can talk about it. So again, I'm Mark from Body Positive. Glad to be here.